Doc on the Run. We help injured runners run.
Today on the Doc on the Run podcast, we're talking about the difference between a plantar plate sprain versus a tear versus a rupture when you're a runner. If you're a runner who has had aching pain in the ball of the foot, you may have been diagnosed with something called a plantar plate sprain or a plantar plate tear, or maybe you were told you had a plantar plate rupture. Of course, the most important factor to a runner is how quickly you can heal the plantar plate and get back to running. Now, the chances are good your doctor really didn't even discuss this component of your treatment plan with you. And when you get a plantar plate injury, many doctors will simply tell you to stop running and let it heal. Well, that plan can take months, and as I've said many times before, waiting is not a treatment plan. Now, if you're a runner with a plantar plate injury, you need to understand the differences between the terms used to describe the condition so you can better understand what you need to do to let it heal and actually get back to running. So let's talk a little bit about these terms we as doctors use when we're trying to describe plantar plate injuries. Okay, first of all, what is the plantar plate? Well, the plantar plate is a very small ligament on the bottom of the joint capsule at the base of the toes where your toe connects to your foot. And when you stand up on the ball of the foot, you're basically stepping right on the plantar plate at each of the toes. Now, a ligament is just a band of tissue designed to reinforce and stabilize a structure by holding two bones together. The plantar plate ligament is mostly made up of collagen strands. So what is a sprain? Well, a sprain is just an injury to any ligament. Now, that could be the plantar plate ligament, or it could be one of the ligaments that stabilize your ankles. And when you get a ligament sprain, you overstretch the ligament, and some of the collagen strands in that ligament actually break. And doctors grade ligament sprains as either grade 1, grade 2, or grade 3, depending upon how severe they are. A grade 1 ligament sprain means there is a tiny little section of damage or like perforations or little tiny rips within the ligament, but they're on the inside of the ligament in the interior of the ligament. Now, if you looked at it, it would look like it's intact. But then if you stretch out the ligament, you might see where there are some tiny little sections where it's been damaged. For example, if you took a flat rubber band and stretched it out a bunch of times and then pulled it tight and you were to hold it up to the light, you might see little wavy sections within the rubber band that would indicate little rips on the inside of the rubber band. Now, that would be analogous to a grade 1 ligament sprain. A grade 2 ligament sprain means there's a very small section of the ligament that's actually torn. If you take a flat rubber band and you actually took some scissors and you cut the edge of the rubber band, well, that would be analogous to a grade 2 ligament strain. In that case, the ligament is still partially intact, is still mostly connected, and is still functioning, but it just has a little rip in the side. A grade 3 ligament sprain means the ligament is completely torn and completely broken. It's no longer intact, and it's no longer providing any support to stabilize the joint. So what is a plantar plate sprain? Well, a plantar plate sprain just means you have some section of the plantar plate segment that has been ripped or torn. However, the term plantar plate sprain doesn't really help you decide when you're going to get back to running. The grading system doctors use to describe ligament injuries, well, that does tell you if it's partially intact, just barely injured, or completely ripped apart. But unfortunately for runners, you almost never hear a doctor tell you that you suffered a grade 1, grade 2, or grade 3 plantar plate sprain. If you think about the term plantar plate rupture, and you think about the grading system we just described, when a doctor tells you you have a plantar plate rupture, you probably assume it would be completely ripped. But that's not necessarily the case. Sometimes if your doctor actually shares your MRI report with you, your doctor may tell you that it looks like you have a partial rupture. Of course, that is different than a complete rupture. Now, by themselves, the term plantar plate sprain, plantar plate rupture, and plantar plate tear are basically useless to an injured runner trying to get back to running. The severity of the injury is what's really important. A grade 1 sprain of the plantar plate is not nearly as bad as a grade 3 sprain of the plantar plate. A partial rupture of the plantar plate is not nearly as bad as a complete rupture of the plantar plate. And a partial tear of the plantar plate is not nearly as bad as a complete tear of the plantar plate. The real difficulty for you as a runner is in trying to figure out whether or not you have a ligament that's partially torn, completely torn, and how quickly it's going to heal. In that respect, you have to pin down your doctor and get a real answer. And if you look at your MRI report and your MRI report does not give you a clear answer, you have to figure it out on your own. Don't ever forget, many surgeons are going to try to sell you a trip to the operating room. If your plantar plate ligament is refusing to heal, and you have really tried all the treatments that can or should get it to heal, then you might need a trip to the operating room, but not all runners should have surgery. The only case when you absolutely have to have surgery is when your ligament is 100% torn, the joint capsule is compromised, and your toe is dislocating. But if you fall in that huge gray area of injury where it's partially intact, the toe isn't really dislocating, the toe still is sitting on the ground, you can probably get it to heal on your own if you just understand how to decrease the stress and strain to the plantar plate ligament. You have to figure out first and foremost if you really have a plantar plate injury and not some other injury like a neuroma. This is part of what we teach you in the plantar plate injury course for runners. Then you have to do a few simple tests and make an evaluation to determine whether or not your plantar plate ligament is partially intact and actually functioning or not. And provided the plantar plate ligament is only partially torn, or it is just a grade 1 sprain or maybe even a grade 2 sprain, you just have to be diligent about decreasing the pressure and the tension on the ligament so it can start to actually heal. This is also a part of what we teach you in the plantar plate injury course for runners. You have to understand that the entire realm of plantar plate injuries can be extremely frustrating for runners. First of all, most of the runners I talk to during phone consultations and webcam consultations really don't even know how bad their particular injury is at the stage they are in today. No doctor's really even given them a straight answer. And if you just step back and think about that for a second, it doesn't make any sense that you should expect you would be able to develop a plan of when you can get back to running if you don't even know how bad the injury is. But you can figure it out. Once you figure out how bad the injury is, you can start figuring out how aggressively you need to treat it so you can get back on the path to healing. Now, even when you're trying to figure all that out, and then as soon as you start healing the plantar plate ligament, you need to work on strengthening and maintaining everything else in your body so you can return to running as quickly as possible. And the bottom line is that you can figure out how bad your plantar plate injury really is. And if your doctor can't help you figure that out, if your doctor won't give you an answer, you need to get a second opinion, or you need to figure out it on your own. But if you do that, you can get it to heal. You just have to decrease the stress and strain on the plantar plate ligament, and then you can continue to ramp up your activity from there so you can get back to running.
Doc on the Run. We help injured runners run.